Risk management is a big part of being a safe and competent pilot. One of the best ways that pilots can mitigate risk is to use a checklist to determine physical and mental readiness for flying. This checklist, called the IMSAFE checklist, is defined in the Pilot's Handbook of Aeronautical Knowledge, or the PHAK. In this book, on page 47, there is a section on mitigating risk, and you see the IMSAFE checklist right in this section. Let's take a look at each element of this checklist. The first one is illness. Am I sick? Am I suffering from any illness or symptom of illness? Flying requires good communication, decision making, and concentration. Even a mild cough or headache can interfere with ATC communications or lead to poor decisions in the air. Some illnesses, such as sinus issues, can get very painful during flight due to changes in air pressure. The second one is medication. Have I been taking prescription or over-the-counter drugs? If you are taking any prescription medication, consult an AME or aviation medical examiner to determine if it's safe to fly while taking the medication. Even over-the-counter medications that are fine to take while on the ground may prevent you from flying. The FAA publishes a reference for over-the-counter medications that you may find very helpful. It includes a table with guidance whether a particular medication is safe to fly with depending on its active ingredient. I will add the link to this reference in the video description. S stands for stress. Am I under psychological pressure from the job? Worried about financial matters, health problems, or problems in the family? Psychological stress can impair your ability to make good decisions and react quickly to unexpected situations. So it is important to identify increased stress levels and take action to manage it before the flight. A in the checklist stands for alcohol. Have I been drinking within the past 8 hours? Within the past 24 hours? A general rule of 8 hours from bottle to throttle will serve you well. The Federal Aviation Regulations, or FAR, state that you are not allowed to fly with a blood alcohol concentration of 0.04% or higher. This is half the limit for driving, which is 0.08%. F stands for fatigue. Am I tired and not adequately rested? Fatigue can be a silent killer, as it may not be apparent to a pilot until serious errors are made. Fatigue can impair your cognitive and physical abilities, making it way more challenging to fly safely. It can impact your concentration, hand-eye coordination, and just make the flight way more riskier than it would have been otherwise. Always ensure that you get high quality sleep before flying and avoid flying when you are likely to be tired. E stands for emotion. Emotional distress can also impair your ability to fly safely. You might be going through a breakup, or a very close one passed away, or anything that could cause you emotional distress is a risk to flight safety. You should address this risk before flying. In conclusion, the IMSAFE checklist is a very helpful tool for pilots to assess their physical and mental readiness before a flight. Make sure you use this checklist before each flight. As always, thank you very much for watching. If you like content like this, please remember to subscribe and like the video. I appreciate you. I will see you in the next video.